Deal TV. Learn and earn.
Now, our cow has calved down. We want her to produce milk, but we have a calf that we need to take care of. So, for those of us who have had calves in their farms and they have taken weight at birth, how many kilos were the calves? Anybody?
For me, I never did do that.
You know, it's very important. It's very important to take the weight of a calf at birth using a normal weighing machine. You put maybe in a sack or a crate. You put the calf there and know the initial weight. The reason it is very important.
Normally they are 50 kgs to 40, 45.
Are you sure? Are you sure? Are you sure? You've done it. Then you must be a very good steamer.
How many?
50, 45 to 50.
What?
Kgs of a calf, a newborn calf. That is what I'm getting. In my farm, it's 45. That is why I'm telling him he's a very good steamer. In my farm, I get, the highest I've ever gotten is 48. But on average, they give me 40 kilos and sometimes 38. So, now, when you're milking that cow for the first time, they give us something we call colostrum. Colostrum. This is a very yellowish, sometimes it comes with yellowish color. Sometimes it comes with the reddish, brownish color. So if you find like you are milking and it is like blood, the first milk, it's normal. Yellow, it is normal. Water is the one that is not normal. It means that your cow is affected with mastitis and you might lose the udder or the quarters. So, once this calf is born, it is born without immunity. So whatever you are giving to that calf is what is giving her immunity. So you're assuming that you don't give your calf colostrum, she's not going to survive. She's going to die. And I think that is where the sale of colostrum is coming in, because maybe a lot of farmers are losing their cows at birth and they are not able to get colostrum. So once that cow calves down to that calf, weigh, see how many kilos she has. Let's take an average of 30 kilos. She's supposed to take milk 10% of the body weight. So 10% of 30 kilos is 3 liters. 3 liters of milk. Immediately she's born. When she's bonding with the mother, milk, the mother, some allow the calf to suckle the mother. Me, I prefer bottle feeding. You bottle feed that and make sure she takes not less than 3 liters of that colostrum.
At birth?
At birth. Immediately. 30 minutes after birth. I insist, not more than 1 hour before you have given that calf that colostrum. Are we together? Sorry? Sorry? No. At room temperature. Well, immediately you have milked. Don't boil. Don't even put on heat. Immediately you give to that calf. And even in the later days, make sure that every milk that calf is taking is fresh, warm, direct from the mother. Sometimes you can freeze the colostrum for a bad day. You can freeze. Remember I say freeze. You can freeze that colostrum for a bad day. But if you have a lot of cows, it is not that necessary.
Then for us at times we have problem. Most of the cows, especially when they are beginning to produce, they give birth when they are hostile. even getting a calf from meat
is a problem. Because you beat him up or her. You are used to hitting all the time. You are hitting. You're used to hitting that cow all the time. You're not gentle with her.
You find when you are going to milk it for the first
It
time.
will kick you.
We have the first time.
Okay, for the first time it is very normal for the first time because it is something new you are doing to her. So the udder is so sensitive, she's very sensitive. But again, if you are very brutal to a cow, she will always be brutal to you. If you are so gentle with the cow, they are very friendly. They are very friendly creatures. But for the first time during milking, it is normal to tie her, but don't tie her like you want to slaughter her. Just a gentle tie. Are we together? So what do you do to this calf? Immediately she's born, you give colostrum at least 3 liters. Continue with 6 liters a day in the for the first week, because that is still colostrum. 2 in the morning. Remember, we say the best time of milking is 3 times. So in the morning you give 2 liters, in the afternoon 2 liters, in the evening 2 liters. Continue with that for a whole week, for week 1.
But you said it's 3 liters. Body
Yeah,
weight,
the 10% of body weight immediately after birth. Then the reason as to why we are giving 6 liters is because we want to challenge this calf to be a good cow and to come on heat early. Give 6 liters. From here, the stomach has expanded a bit, so she's going to take more. Then we are giving differently. In the morning 2, after 8 hours 2, after 8 hours 2. Immediately after birth. Immediately after birth. If it is 10% of the body weight, if you measure your calf and is 40 kilos, 10% of 40, that is 4. But in the later days, give at least 6. If you want to challenge your calf, you can go up to 9. But remember, as I told you, too much of protein is waste. So if you give too much of milk to that calf, sometimes you're going to get scoring. You're going to find that she's having a whitish diarrhea. It is because of that milk. Any other type of diarrhea is brought by unhygienic conditions in the calf's house.
A moment. Come again.
When you're challenging that cow, but any other color is because of unhygienic conditions in the calf's house. That takes us to our next point. A calf's house. Now she's born. We have given colostrum. We want to house her. How should that house look like? It should be raised above the ground, warm enough, proper ventilation, and should have 3 containers for feeding different types of feeds she's taking on that day or in that particular time. Number 1 is what are we giving? The first thing we are giving to this calf, it is the milk. So that is the bucket number 1. The bucket number 2 is for
Hey.
For hay. No, the first week.
First week.
Yeah, the second bucket is for
Water.
for water, and the third bucket is for starter pellets. The starter pellets. So
First week.
the first week, and these containers are going to be there for the next 3 months. So let me explain this. I heard someone say that they don't give their cows water until they are 3 months. Who does that here? After 3 months, you give water after 3 months.
For me, I leave them until they go and drink for themselves.
So you don't bother. You don't bother to give at early stage. You don't bother. So at what time did you note that your calves are taking water?
Almost 4 months.
The first time they're taking water.
For me, they just keep on following their manners. They look at their manners.
Water is very important. So I'm sure you have the calf starter pellets. You can show them what it is. It's a feed that is very high in protein, and it's made from alfalfa or lucerne. It's a feed that is made from alfalfa or lucerne. But at this stage, you just give a handful. Don't give like a whole kilo of it. That calf does not know how to feed, does not know how to chew. Remember, you are training her. So you start with a handful of it. You just scoop a bit of it, put it there. The first time she's going to lick a bit and she's not going to eat much. But the trick is changing every day. If you let it stay in the trough because she has not eaten, once it is exposed to air, it starts to form mold, and you introduce toxins in the delicate stomach of that calf, and you'll see scoring, and eventually your calf dies. So every day you change that pellets you give, whether eaten or not eaten, and that is why we are using our hand to scoop a very small, half your hand. By the time she's hitting 3 months, she's supposed to be taking 1.5 kilos of that by the time she's hitting 3 months, with at least 2.5 times the birth weight. Having added kilos, at least 2.5 times the birth weight. Are we clear? So week 2, we are introducing calf starter pellets, and we are giving a handful. By the time she's hitting 3 months, she should be taking at least 1.5 kilos per day. As she's eating more, you add more. So if you give that handful, she finishes before the end of the day, please add. If you notice that it is scoring, please stop, because it might be rotten, overstayed, or has aflatoxins.
What is scoring?
Scoring is that diarrhea you see in calves. It is diarrheaing. Are we together? So, week 3, you introduce hay, the dry matter. Week 3, you introduce hay. Why are we giving hay at this stage? Yes?
You say if it is scoring,
You
stop.
reduce or stop.
And then what happens?
You treat. If it is too much, you treat. You call the vet to treat. Okay? You call the vet to treat. But if it is the starter pellets that had a problem, once you stop feeding, the diarrhea stops. Are we together? So on the third week, you introduce hay. Why are we giving hay at this stage and not silage? Any idea? Anybody?
Because of rumen.
Yes, because you want the rumen to develop. Because of rumen development. Yes, it has the 4 compartments, but they are not well developed. So when you're giving a lot of dry matter, you are helping in the rumen development. And I'm going to give you a trick. For my farm, you're going to come and see. I give my calves hay until when they are 7 months. They eat pellets. The first week they take milk up to 3 months. They take pellets up to 3 months. They take hay up to 7 months. They are taking hay. Because the more the rumen has developed, the higher the growth rate. Okay? So I really like giving them a lot of hay for the rumen development, and that helps me to serve my heifers at 14 months with a weight of around 340 kilos per day, which is an average weight. Others at 350, others at 320. But the average weight for AI service at 14 months is 340. You should not serve a Frisian heifer with that less kilos. Okay? And by the time she's 40 kilos.
340 kilos.
Yes. It should have hit at 14 months if you've really raised her well. So on the third week, you have reintroduced hay. You continue giving that hay and water plus milk. Milk, you can continue 6 liters. For my case, I give up to 2 months. They take 6 liters. And then after 2 months, I start reducing gradually. So by the time they are hitting 3 months, they are taking 0.5. The reason as to why we do this you find many calves start to lag behind after 3 months, because once you have weaned them, you've not weaned properly, they get shock. And you'll find somewhere you're being told to give Calm Boost. Is it available in your shop? Yeah. Calm Boost. You give Calm Boost to increase the rumen microflora for the development of rumen and the intake of feeds. And we don't want mostly to go there. We want that calf to grow naturally. So on the 3rd month, for people who do free ranging, how many people do free ranging? The ones that don't have a zero grazing. Yeah, for those people, it is good to deworm your cows monthly. I'm against the injection one because it only covers very narrow range of worms. I prefer oral. Oral, every month you deworm. You keep on alternating between albendazole and levamisole. Are we together? If this month you did albendazole, the next month levamisole, and you make sure that when they are about to anneal, you give a dewormer that has trace elements, minerals, and when they are 3 months to 10 months, you give one that has supplements like selenium. For instance, you can use Niels and Super, you can use Nemarid, you can use Multicure, and all of them, I think they are available at Uganda. Are they available?
Yeah, mostly I sell Multicure.
Okay, Multicure. So you can get them. So make sure you deworm monthly. For those people who are free ranging, you can start at 2 months at a lower dose. You'll find albendazole, they are telling you 10% of the body weight. You're going to find levamisole, they are telling you 2.5% of the body weight. So make sure that all that you observe that when you are deworming that calf. Now, after 3 months, you introduce pencils, calf pencils. They are still like pellets, but larger than pellets, and they have high energy, high protein for the growth rate. Now this one you feed up to 7 months. When your calves are 7 months, the young stock you can get from Pembe, the common ones, they are from Pembe. We have Unga. I think they are available, those ones. I'm trying to think something that you can get in your place easily. That is why you see like me, I'm trying to guess. It's the ones that are available in your place, because in our place we have variety. So we give young stock pencils up to 7 months. And now you have stopped giving milk. You increase. By the time she's hitting 7 months, she should be taking at least 4 kilos of young stock pencils. So from 7 months to the time she's 7 months in calf, now the calf that was born, you can opt to give dairy meal. Let me be keen on that. But you can also decide to formulate your own feed for them. Are we together? You can decide either. We have a feed that is made, but I know that one is not available because it is made through by an order. But the best thing you can do is maybe give already formulated dairy meal, or you formulate your own dairy meal and then you give it to your calves, or you give dairy meal or formulate yours until you feed until she's 7 months in calf. There's something I forgot, mineral supplements. In every stage of a cow, we have different type of mineral that you should give to a cow. For a calf, there is that for Ndama. Ndama is a calf. So there is that mineralic, for example, Maclic, Extra Legend. We have Tugalic Ndama, we have Vital Ndama. I think he can get them easily for you. For heifers, we have for Joto, for heat. And this heat, the reason as to why we are giving these heifers for heat is to make them ovulate. It has trace elements in it and supplement that will make that heifer come on heat. So we start giving this on heat at 10 months or 1 year. So from the time she's a calf to the time she's 12 months or 10 months, you can give that for a calf. But after 12 months or 1 year, you should shift to Joto. We call it Joto or Maclick Plus. Twiga Joto. Twiga, I think, is a global company. You can get from them, and I'm not marketing them. I'm trying to think whatever is available in your place, and also I know he can get them easily. So Twigalik Joto, for them to come on heat. When they come on heat, you continue giving until they are 7 months in calf. Now, when they are 7 months in calf, what do we do to that heifer? We dry off or we start steaming. Now, when we start steaming, we feed exactly the way we steamed the mother. The only difference this time round is that she's not on milk. So that dairy meal you are giving should be as low as possible, just the way we did. But make sure you have not fattened your cow. Are we together? Any question? Any question?
When we are at right farm, we are talking them their calves. There is a time when they give them during the mid hours of the day. They give them some warm water.
Yeah, water.
Milk in the morning, warm water in the afternoon.
As you said, this is a very important thing you said. You said that you wait for your calf to learn how to drink water. This young calf does not know how to drink water. But because I want her to train, I have to always put water there. So that even in her mind, she can know this is water, this is milk. She can be able to differentiate. But because she's not taking, it is always advisable you give her water. Give her like you're giving milk. If a 1 month calf, you can give from 1 liter to 2 liters in a day as you go increasing gradually. The same case, I even do that in my place. But when the water is there, by the time she's hitting 1 month, she knows it is my time to take water. When you start introducing hay, you start introducing pellets, she will be thirsty and she will take that water. So it is very much okay. Now, from there, and because I'm almost winding up, I want to talk a bit about common metabolic diseases, the common ones, and management. A bit on management, on what you should have in the farm to make sure that you have proper management. So I'm going to start with common metabolic diseases, and then I end with management. So the common one that we know is milk fever, or hypocalcemia. It normally happens immediately or some days after the cow has calved down. And this time, it is caused by low calcium levels when giving birth, because you never give the dry cow mineral salt. Low calcium levels, the sign that you are going to see is no feed intake, recumbency, your cow cannot be able to stand. If she is standing, she is trembling, muscle tremors. Also, you are going to notice dehydration, lethargy, all that. And you find her flat like she's dying, and convulsions. Has anyone experienced such signs? It is a very dangerous disease, kills within 48 hours if not managed by the vet. But you can prevent that through proper steaming and to avoid fattening. There's someone who said he loves fat cows. You don't have to fatten your cow. If you fatten your cow, she's going to have negative energy balance that will lead to hypocalcemia. So treatment, you supplement with calcium. By the time she's not recumbent and she cannot be able to stand, you can supplement with oral calcium, the one that we said, it's called animatic calcium. No, he can get it. And if she's down, like she cannot stand, that is the vet, intervention of the vet. He gives an intravenous dose that is injected direct to the bloodstream using a jugular vein or a milk vein. it is supposed to work very fast. And if it is attended within the first 6 hours, you can save that animal. Also, in high producing cows, you experience that. High producing cows, you experience that. And that's why we insist on giving salt of high phosphorus. Okay? So for milk fever, any question? So the other one is ketosis. Ketosis is a very strange disease to understand, and many people mistake it with milk fever. But ketosis comes like, yesterday your cow produced 15 liters in the morning. Today in the morning she has produced 3 or 4 liters. She's still eating, but the body condition is still losing the body condition. She's very thin. A good dairy cow. Someone to tell me, how should a good dairy cow look like? Anybody with an idea? A good dairy cow should be wedged shape, like a wedge. You should be able to see at least 3 ribs. 3 ribs. You can be able to place your hand at the 3 ribs, but the third one, it is not clearly visible. You can see there is a rib, but it is not very visible. That is a very good dairy cow. Should have good udder attachment, but that is another topic of breeding. I just wanted to explain how a good cow should look like and how to differentiate with the ketosis. For ketosis, the ribs, you can see like 6 ribs. And then we have hollows here on the hip bone. There are deep holes that you can put your hand or place some water, and the back line is you can spot the what do we call it? The spine. You can spot the spine from the back line. So that is ketosis, and it is caused by negative energy balance which is brought by fat cows. If your cow was too fat when it was dry, too fat, I mean she looks like a block. She looks like a bull. That is a very fat cow, a body score of 4 or 5. So if your cow was like that when she was in calf, if she gives birth, definitely she will go under ketosis. She will stop using the energy that you are giving and start using the energy she had reserved. It is a very dangerous stage, and also your cow can die from that. So for prevention, you can use Ketonex. I had him talk of Ketonex. You can use Ketonex. He'll give around 240 ml per day for like 1 day. But if the cow is already in ketosis, it might not be of much help. You just help by giving feeds high in fiber, like silage, wheat bran. Don't give a lot of proteins, and hay. Are we together so far? Then we have another one called grass tetany or hypomagnesemia. That one is very common for people who do free ranging or paddocking. Very common because our cows graze outside. Also, I do free ranging or paddocking. Our cows eat from outside. Now, what happens after a long period of sun or drought, if it was not raining, when it rains, a new grass starts to sprout. So this grass is very concentrated in magnesium. So if your cow eats that, she'll definitely get that grass tetany. And signs are staggering, loss of sight. She looks like she's mad or he's mad, like that. Or it is in another word, it is called a 3-day sickness. It's supposed to go away by itself, but you can treat it with medication of hypomagnesemia. Magnesium, you can give magnesium. So, and also we have another one that is very common called rumen acidosis. Rumen acidosis is whereby you find your cow has bloated. You've given too much of concentrate, too much of maize germ that has aflatoxin. Do you use toxin binders in your feeds?
Yes.
A lot of it, right? Because the challenge we have with maize germ from your country is aflatoxin. You do wet milling, right? So that wet milling makes the maize germ not to be fully dried. So if you store at time you're going to find it like it has stones and molds. So that is the aflatoxin, very dangerous to animals and human beings. So you should always incorporate toxin binders in them to bind all the toxins. Okay? So acidosis is brought by that when you give too much concentrates. So prevention is you give concentrates in moderate. Not too much, not too little. The last one and the most important one is displaced abomasum. I think I explained this one earlier. So I told you if it ruptures, you lose your cow once it has given birth. It normally occurs immediately after the cow has calved down. That is the time you get displaced abomasum. And if you are not able to manage it during that time, you cannot get, you are going to lose your cow. Are we together? Any question? Those are the common metabolic diseases that affect dairy farmers. The most common ones that needs management. All these conditions, they are not diseases, and that is why we are calling them metabolic diseases. They are manageable situations. I've not talked about mastitis, which is a very common one. Mastitis is caused by various factors. Number one, genetics. I don't want to go to genetics. It is caused by improper milking or incomplete milking, and also hygiene. But the most common one is improper milking or incomplete milking and unhygienic environment to that cow. So those are the causes of mastitis. For you to prevent them, I always caution farmers who use towels, cleaning the udder. You find like you have 8 cows, but you have 1 towel. In fact, if you go to places like Holland, you'll find like every cow has 3 towels, for AM, for PM, and for evening. You won't find that one is for the whole day. And if it is too expensive, they use disposable tissues to clean the udder, because that towel transmits mastitis from one cow to another. But for my case, I say you can use plain water or that disposable tissue. Treatment, it will depend. We have 2 types. We have clinical and subclinical mastitis. They are the ones that you inject a cow followed by intramammary tube that you can use. But mostly, if it is subclinical, once you clean the udder, you do the complete milking, it goes away by itself. Are we together? So, those are the common metabolic diseases. Yes?
How about retained placenta?
Retained placenta is not really, okay, it's a common, it is a metabolic condition caused by improper mineral supplementation during dry period or not doing the steaming up well. So normally a cow should remove the placenta between 12 hours after calving down. Beyond there, it should be removed by a professional after 3 days. Okay? Removed by a professional after 3 days. After 3 days. So if you do earlier than that, you're going to damage the tissues around the uterus.
Come
Are we
again?
together? I'm saying,
In case it fails to drop down within 12 hours,
yes,
we should wait for it for 3 hours.
for 3 days.
3 days.
3 days.
On the 3rd day or on the 4th day?
On the 3rd day,
Just when the
placenta should be manually removed
Why especially?
by a professional, not just a huntsman.
If you wait for 3 days,
Uh-huh.
aren't we inviting in like infections to the cow?
No. No. Actually, no, the dogs. The dogs. Sorry? You give
Pen and
what?
strip, it says.
Oh, penny strap. No, you cannot inject and it comes down. There's
something I noticed that, this is what I'm saying, I experienced that, okay, I didn't steam it only. But if you take long, if the cow takes long with that, you see it's trying to push what they call it?
the placenta.
The uterus to come out.
The placenta.
Yes, the placenta. Yeah. Then you see people like pushing it, okay? And someone told me that if you don't remove it within a given time, it could even pose.
Now, that is what I want to explain. After 3 days, the tissues that were attached to the uterus, now the placenta, there were some tissues that were feeding the baby, and they were attached to the uterus. That is why that baby could stay in there for 9 months. After 3 days, they have rotted and they are ready to come out. If you give earlier than that, you're going to injure the uterus. If you go beyond 3 days, it is going to start rotting inside the uterus, and that is where infection comes in. After we remove it on this 3rd day, we remove manually, but because my hand and the glove is a foreign thing that has gone in the uterus, I have to put that penny strap in the uterus as the antibiotic to clean the possible infection that I might have brought in. Are we together now?
I just put it inside the uterus.
Not you, but the vet. Not you, but the vet.
He has to put it inside.
After he has removed everything. So if it has infection, you will inject. But if it was only RAB, no need. If it doesn't have any other condition, you don't inject anything. Yes. Yes.
There are also other tablets, but I don't remember the names. Can you please?
For what?
There are tablets they put inside the sack. Then it
that is for irrigation. There's a difference between removing the RAB and the irrigation. We call the process irrigation, but you'll find that your cow is coming on heat, but it is not conceiving. It has the cycle, but it is not conceiving. The vets tell you have to do uterine irrigation, and you give those tablets. The word is something you put there. It's for irrigation, for flushing out the infection.
Madam,
yes.
About whatever placenta is what?
Placenta.
Retained
after birth.
Stone. Most of the farmers here we have bananas, not so? During the time of steaming, before even steaming, just collect those bananas, crush them, put them in the sun to dry.
Banana
flour. The placenta is not a disease.
Yeah, it is not a disease.
Placenta is not a disease.
Yeah.
Just get that banana flour. During the dairy meal steaming, add them in your dairy meal. That's what you can do. You will not see any retained placenta in your farm. Banana flour.
Yes.
But those tablets are recommended by the vets. What are the side effects? Because they always use those tablets.
They don't have any effect.
The placenta.
It is not flushing out the placenta. They manually remove, right?
No, let me explain that. Otegeeza nti bwe bateekamu omukono ne bajja mu placenta balina amakerenda ge bateeka sikyoligo.
Yes. Now,
now, madam, she's saying that the times when the retained placenta, sometimes there are those, I don't know if they are this or not, they just put tabs.
When the cow does not have the placenta.
when it has not already dropped it. It has not already dropped it. They put those tabs and it goes out. And others, they do it manually. After manually, then they press also the same tabs.
To flush out the remains.
After it has removed. Now let me get this clear. They put before it has removed or after? Both of them. But
in case it delays.
Before is not recommended. It is only after. After you have done it manually, then you put. Because it is an antibiotic. You get? So maybe they do it wrongly. Because, yes, sorry, I hadn't seen your hand.
Thank you very much. Within the placenta is really a pertinent issue. It has residue effects. So it is something that as farmers, we should ensure that we prevent so that it doesn't happen on our cows by properly steaming our cows as she advised. If you properly steam, the chances are
low,
very, very minimal. But in case it happens to you, the best thing should be to invite a vet.
Yeah.
Why? You know, that uterus is very, very sensitive. If you wrongly play on it, it will affect the high conception of the cow. Any maneuvers that you do, because it's very sensitive, it is an aseptic environment where bacteria are not supposed to be introduced there. So we would advise farmers to really the cow will just come back on heat. Even when it comes on heat, you will do quite a number of inseminations before it conceives.
Yeah.
So, in an event that it has happened to you, the best thing will be to call a vet. So there was some confusion over what to put. Normally, when a vet manually gets that placenta out, there are some vaginal substances that are inserted there. And they clean. Because it's really hard, the time that the cow has been having that placenta, it sits down in the cow dung, bacteria have gained entry into the uterus. So they are also supposed to be that and literally do the cleaning. How I'm understood.
Yeah.
So the best strategy is to prevent it. You can
To prevent.
Being proper steaming.
Yeah. Yes, you can. Yeah.
Then you have to invite the vet.
Yeah, you can prevent. Sometimes you cannot be 100% because even me myself, sometimes I find myself in such situations whereby I have a case of retained placenta. I have a case of milk fever. Like last week, I lost a very good cow for aspiration pneumonia caused by milk fever. And as today I was coming here, I was late because of the rain, and also I was attending to a cow that has displaced abomasum. So it happens even to us experts. But when that has happened to you and you have not been able to attend to that cow, let the professional do that work. Whatever they put there, you as a farmer, sometimes it's none of your business so long as the cow is okay. But sometimes it is good to follow up, what are you doing to my cow? But if you do a proper management, a vet will not have anywhere in your farm. He will be coming for insemination only when you do proper management and when you do 90% of what I've told you here. In my farm, I have over 100 cows, and we go for a month without inviting a vet for a condition like any condition. Maybe they come for service, they come for like that one displaced abomination, but once, because management has been observed so much, so much. So you can prevent those metabolic diseases. Then there are those now common diseases like foot and mouth. There's like we have diseases like like pneumonia, we have laminitis, we have foot rot. Those ones you can call the vet to come and do. But for foot rot, it's something that you can prevent at the farm through making sure that where your cows are stepping is good and of good hygiene, and having a foot bath for your cows.
Madam, is your phone number on M-Pesa?
Yeah. So you make sure, now that takes us to somewhere I want to finish off. So foot rot, you can prevent it to the farm. Now we have common diseases and that affect our cows, and we have common ones like East Coast fever, we have anthrax, we have foot and mouth, we have lumpy skin. Those ones we prevent through routine vaccination. Those ones you prevent through routine vaccination. ECF is a lifetime vaccine. Once a calf is given the vaccine, it's a lifetime vaccine. And ECF for our country, it is manufactured in case there is an outbreak. For your country, I'm working with NARO to know how they do it, but I'm glad they came with a tick control vaccine. Have you seen it? Yes. Tick control vaccine, which is going to help you so much because you're going to be free from East Coast fever and tick-borne diseases. I know they are a problem in your place, the tick-borne diseases. For the foot and mouth, also vaccine. After every 6 months, you do the vaccination. I don't know whether it is available in your country, the FMD vaccine. The anthrax, it is done the same. And lumpy is done yearly, lumpy skin. So those are done through routine vaccinations. So it is good to liaise with your government officials or experts like them to guide you when to do that. But it should be a routine for every farmer. It should be a routine, because once foot and mouth hits your heart, it swipes everything. So foot and mouth, it is a disease that affects foot and mouth. Sometimes the genitalia, sometimes the udder. Okay? So it can come today affecting the udders, tomorrow the genitalia, the other day the mouth, the other day the feet. Incubation period 10 days, and it takes about 7 days to clear. Okay? Now we go to key management that you should have in the farm. Is the feeding management. You should always be sure where you are getting your feed. I tell farmers, if you want to be a serious farmer, do not start by buying cows. You start by what?
Growing feeds.
Growing feeds. Not even dairy meal, fodder, the refuges. You need to have a strategy and a plan on how you're going to feed those cows when they come to your place. I tell people who buy cows from our place that there's no need you come and take a heifer from our farm and you go take it and make it suffer. It's better you leave it here. So make sure that you have enough feeds. Then you'll go to their farm, they'll tell you this heifer is going to produce 40 liters on the first lactation. But you have forgotten them, they have maximized on feed management. But you're just buying because your friend has bought, or you're buying because you see your neighbor with beautiful cows. Then you buy from them, it comes and produces 3 liters. And then you start saying, they are scammers, they lied to me, all that. But you have not managed your feeding program on what you are going to give to that cow. Number 2 is the housing. About, if not 80%, about 70% of production, milk and fertility that you get comes from the comfort of that cow. How comfortable is your cow? Cows love comfort. When they have comfort, they forget every other problem. So they love to be comfortable. So if you keep them in a condition where they are not comfortable at all, you're not going to get anything. Like she's swimming in the mud, and the sleeping area, it is muddy. She's not going to give you anything. Or there is a lot of that manure, it is up to the stomach. Mastitis will always be a part of your life, and foot rot. So the housing, we normally say east-west orientation, so that when the sun is passing, it can pass on both sides. East-west orientation when you're building your shed. I'm not against mattresses, but personally I don't love them. So I always advise farmers, but if you have already built, don't destroy or don't demolish your structure. I always advise the farmers to let the sleeping area not be cemented. It should have soft sand, rice husk, soft marram, all that. It improves the comfort of the cow, improves hygiene, because even if the cow urinates on that soft sand or marram, it is going to be absorbed by the sand. On mattresses, I find it unhygienic, but I'm not against. If you are able to keep the hygiene, go ahead with it. My people cannot maintain that. My herdsmen cannot maintain mattresses because we'll fight all the time because they won't clean. And then I find a lot of water being used in that mattresses. So I prefer them not cemented, but I don't have at the moment, but I'm going to have. I do paddocking. We do free range in our place, but we are going to have a shed. Maybe next time when you're visiting our country, you're going to see the kind of a structure I'm suggesting. The other one is health management. Health management is whereby we talked about the common metabolic diseases, how to prevent them, and the health of the cow. The health of the cow is determined by whatever you are feeding the cow, apart from breeding. Okay? When you're breeding, you can determine the health of the cow, but other than breeding, it is what you are feeding the cow. Are we together? You cannot just feed your cow anyhowly and expect it to have a good health. The other management is breeding management. This is the most important topic. I think you're going to cover it later, maybe tomorrow. But breeding is a planned or controlled mating of animals to acquire desired traits. For instance, your cow is, let's use tone. They are producing 7 liters, but genetically they can produce 7 liters. That is their genetics. I'm not saying that way. I'm just giving an example. The way they are, they produce 7 liters. And you want to improve on the 7 liters. That is where breeding comes in. You select the cows that is producing 40 plus liters. You serve to this cow that is giving 7 liters, the daughter of that cow. You are not improving on the mother. You're improving on the daughter. The daughter is going to give you more production than the mother gave you. Okay? When you come to our farm, you're going to understand more on genetics and breeding, because that is what we do there. We are breeding now for production and some small mistakes in our cows. But when you are breeding, whatever you want to correct, maybe you have a very big cows. In our farm, you used to have, I told you the biggest cow I have is 830 kilos. You can imagine how that cow is. Now, a few years, like 7 years back, all our cows on average were 750 kilos. So you can imagine the amount of feed we used to feed on those cows. So through breeding, we have now achieved 650 kilos of cows through breeding. So that is what I'm saying, it is breeding. Now, in this breeding, there are subtitles. And one, it involves the selecting the best males for insemination. Like I've told you, you can opt to use a bull. You can opt to use AI. You can come to my farm and tell me, I need a bull from your farm. I go and use in another person's farm, maybe his farm, he has good pedigree bulls. And when I say the pedigree bulls, I mean the registered pedigree bulls that you are sure they are pedigrees, and you serve them to your cow to improve on the production of your milk. Number 2, the time of insemination. For you to achieve proper breeding management, time of insemination. What do I mean by time of insemination? Anyone with an idea? Apart from you two. You two, I know you must have the idea.
The what?
The time of insemination.
12.
Not you. I wanted them. They have not had. Time of insemination. 12 hours what? So we call it AM PM rule. For instance, right now I'm called by my guy. I have a cow that is bulling. What's time? It's around 10. At what time should the vet come? 10 a.m. tomorrow morning. Okay. I hear vets telling me like late insemination gives heifers, early insemination gives bull. I'm not sure of that. I'm not sure, but that is what they tell me they do. So the AM PM rule is very important. If you give too early, the cow, the hormones are very active because she's mounting on the others. Now, I have a question. Here I have 2 cows. One is mounting on the other and another one is standing to be mounted on. Which one is on heat?
The one which is not moving.
The one that is being mounted.
You, I don't want you to answer. They are learning. They are learning. Which one is on heat?
The one that they are mounting.
The one that is being mounted on, or the one mounting?
No, the one that is being mounted on.
The one that is being mounted. We call that standing heat. If she stands still, she's not moving, and she's being mounted on, she's ready for service. But if she's mounted and she runs, not ready. After 12 to 18, you can serve 12 to 18 hours because at that time the ovulation is, the cow is really calm and is ready to receive the semen. Have a question?
There are times you say that the cow that is being mounted is on heat, but there are times, let's say those people who use tags, the way they detect is the movement. So sometimes the cow that is mounting all the time is detected to be coming on heat. So I don't know.
There are different signs you can tell that your cow is on heat. Number 1, and the common one is that one, mounting on each other. Being mounted on is the common one. Others, they mow a lot. They'll keep on mowing, running up and down. Others will be very alert, always on the fences, looking who is coming there on the fences. Others, they cut production to 0. Have you experienced that? They cut production to 0. Are we together? And others, they don't eat at all. So they are different. But the common one is that one. Even if you tell people, herdsmen will just tell you, and this cow has been mowing the whole day. And then after 3 days, you see blood. You have missed the cycle. Have I answered your question? Okay. Yes?
Thank you. Just throw me light on that. This cycle is a phase. It takes some good hours. So in the beginning, when the cow is just getting on heat, you find that the cow which is on heat, the first 6 hours, the big one is on heat. I think you've observed that.
Yeah.
So after 6 hours, that cow will stop jumping on others, and then it will stand. So that is where farmers need to be very careful. Because this herdsman will tell you, you see those 2 feathers. when it is jumping on others, you will report a different cow. Now when it is standing and others are jumping on it, you also report a different one. Cow. So you need to be really a bit knowledgeable. Like she talked about other signs that come along with it. So
let me cut you short. So if your herdsman calls you, like tells you, like my cow is on, your cow is on heat, in your mind count like 4 or 5 hours before, like you've noted, has called you in the 8 in the morning, and that cow had started 3 a.m. So you count between 4 and 6 hours ahead. So you'll find that doctor will come late in the evening, because they have noticed when this cow is standing still. Okay, so if they tell you like right now, you might say tomorrow, but it has started 6 hours earlier. Okay, so you should have that idea in mind. Push forward for some few hours. If you are not on the farm, if you are relying on the information from the herdsman. Yeah.
Is it a must that it must be within 12 hours?
I said 12 to 18.
12 to 18.
For a heifer goes up to 36 hours. For a heifer, it can go up to 36 hours. But for an already milked cow, it is 12 to 18 hours.
Okay. Secondly, you are talking about the structures, not destroying them. You talked about east-west. I never understood that.
The east-west orientation, where your sun rises from the east. So you see your direction, where your sun rises and where your sun sets. But if your place is cold like ours, orientation is not really important. It is very important on drier or hotter areas, because when you build your structure in the south-north orientation, the sun tends to get direct into the barn or the structure, and you get low production because of stress heat. You get poor fertility because of stress heat. But when you do east-west orientation, the sun passes over, it is not over the structure.
So cows don't need sunshine?
They need, but they are stressed by heat more than cold. They suffer from heat stress, so they need it in moderate. But if your place is not that hotter, orientation is not really necessary. And then in the north-south orientation, you find that a lot of rain is getting into your structure because of orientation. Yeah, that is the importance of orientation. So another care you are supposed to take is the pregnancy and reproductive health. It helps to understand if your cow is having problem in her reproductive health, like those RAB. You can tell with the history. If you have a history, you have done the breeding records, you can see a history. God willing, when you're coming, I'll have a sample of the record. I'm going to show you. It can give you a history of this cow. You might find that every cow this calves down, she has RAB. She normally gets RAB. So you will understand the history of a certain cow when you have the record. Also for pregnancy, you just keep the record, the AI certificate, the one that he has used, and also a breeding card where you note a date of insemination, expected date of confirmation. Do you do pregnancy diagnosis on your cows? Pregnancy diagnosis, or once you serve, you wait for the baby to come? No, you should be doing pregnancy diagnosis at 4 months. And here in Kenya, we have advanced. We have a kit like the one us women use to test our pregnancy. What do we call it? For pregnancy test, like that litmus paper, whereby you take a blood sample, you put there, and then it will show you 2 lines if it is positive. If it is not positive, there is no line, and you can confirm your cow within 28 days. I'm going to tell you more on that. Another management you should be observing is hygienic milk production. So you cannot produce, the shelf life of milk is 4 hours. That is the shelf life of milk. fresh milk. So if you milk your milk after 4 hours, the bacterial count has started to load if it is not chilled. But if you don't observe hygienic milk production, within 1 hour, the fermentation has started. The clotting, you find that your herdsmen, they are not cleaning their hands, they are not cleaning the udder. How do you clean the udder, by the way? I said we do away with the towel. We agreed we are doing away with the towel. You know, in my farm, I find them, they are washing teats. Only teats. They know that teats is the udder. But the udder is the whole pocket. Make sure it is clean. Because if it is not clean the time you are milking, that dirt that attaches to that udder gets into your milk. Okay?
But the tissue sucks water or the wetness. So
you're going to dry. We said use plain hands or disposable tissues. Yeah, you're using, assuming you're using that. But if you are doing a zero grazing, imagine you are forced to wash the whole udder. People who are supposed to wash the teats only are people like their cows sleep on the grass. They are always clean. Okay? So that is the milking hygiene. And the last one and very important is the record keeping from calves, dry cows, breeding, milk. You should have a history of each and every cow, and that helps you in breeding. I wish I can take you in breeding. That is my favorite part. So record keeping is very important, very, very, very important, because it gives you the history of that cow. In my farm, you can trace a record of up to back 1980. So we have those records, and they are very important. They will help you with breeding. They will help you improving milk production. They will help you improving in your fertility and all around your dairy farm.
Deal TV. Learn and earn.